Hello, you're welcome once again back to Love Your Health YouTube channel. It's very important to love your health. I always say that. And loving your health means preventing diseases and living a healthy life. We are continuing with the topic G6Pd deficiency. G6Pd deficiency. Today's video is on the management and complications of G6Pd deficiency. So let's look at the management of this G6PD deficiency. For us to manage G6PD deficiency and live a healthy life, we have to avoid the triggers. Example, the fever beans. I said that some of the triggers are medications and others are foods. And research shows that many people who have G6PD deficiency react to fever beans and other leguminous foods. So please take note of that. G6PD people react to fever beans and other leguminous foods. So please, anytime you take any legume foods and you have a reaction, please, you have to stop immediately and see your medical practitioner or your doctor. That is very important. The next one is also you have to go to hospital anytime you feel you are not fine, so that you can take medications that are appropriate for your system, that will not break down your red blood cells, because we said in the previous video that people who have G6PD deficiency don't take drugs that contain sulfur. There's a group of drugs called quinolone. They are drugs that G6PD people react to. So we also mentioned some anti-malarials like sulfadosine parametamine that they also react to. So it's best to see your medical practitioner when you are not feeling fine. Don't go for over-the-counter medication. It won't help in this situation. The other one is also you have to always go to the medical practitioner with the list of medications that you react to. So when you do a test and you are G6PD deficient, what the doctor do is that they give you a list of medication to carry around. Anytime, anywhere you go for treatment, you have to present it, so that your doctor may not give you medications that are not good for the system or that are not good for G6PD deficient or defect patients. The next one is that you have to avoid stress at all costs. Stress also helps in the breakdown of the red blood cells often. Stress is not a good thing in any disease condition, so please avoid stress. Try to manage your stress. Try to talk to somebody when you're under stress. Do things that distresses you, so that you'll be able to distress yourself as much as possible. Then the next one is that when you realize that you are weak, you have the signs and symptoms, and you're having a crisis of the G6PD deficiency, please don't stay at home and take blood tonic. Please, you have to see your medical practitioner. Don't go for over-the-counter medications. So this is the management of G6PD. Please, you need your doctor to help you at all costs, and also personally you have to avoid the triggers so that you don't get sick, so that your red blood cells does not get breakdown quickly, so that you will be healthy all the time. So let's talk about the complications. Some of the complications of G6PD deficiency is hemolytic anemia. I talk about hemolytic anemia. Hemolytic anemia is one of the complications of G6PD deficiency. When I say hemolytic anemia is an anemia that the red blood cells break down prematurely and frequently, and the body cannot replace it as such. Then you have an anemia called hemolytic anemia, meaning that your blood level, your hemoglobin level is low, but as a result of the breakdown of the red blood cells that the body cannot replace as its breakdown. Yeah. Next one is neonatal hyperbilirubinemia. The bilirubin level becomes high in the system, and it gives you that yellow coloration of the eye, the skin, and the body, the whole body. So it's very important that we don't get to that stage, and that also can destroy, especially with the neonate, it can destroy their brain for life. So it's very important we don't get to the complication. The next one is splenomegaly. It's a big word, but I'll explain it. Splenomegaly, there's an organ in the system called spleen. Its function is just to make sure that when the red blood cells breaks down, it picks them up in the system and sweeps the system so that the system becomes clean. That's its work. So this spleen, because in G6PD deficiency, because the red blood cells break down prematurely often, what happens is that this spleen has to work extra harder. So when that happens, it becomes bigger, it's inflamed and becomes bigger. So splenomegaly simply means that the spleen has become bigger than the usual size. It means that the spleen cannot work properly because it has been enlarged in a way. So it's not good for us to get to the complicated stage. This brings us to the end of G6PD deficiency. Please go to my channel, Love Your Health, and please subscribe to my channel, like the videos. Please don't forget to share. It's very, very important for you to share. Maybe you might not need it, but it can save somebody's life somewhere. Please save somebody's life by sharing this video, and don't forget to send your comments. This is from your preventiveness. Watch out for more educative videos on this channel. Love you all. Bye bye.